Hello everyone, welcome to my channel Ravi Aesthetic Physio. So in the series of pharmacology, we are moving further and taking another topic which is steroids. It is also essential for your university examination. So how you can write in university examination? Let's explain about it. So steroids. What is steroids? Like types of steroids or like mechanism of action. So all of we are studying in here. So steroids is a biological active organic compounds. They are made up of four rings that are arranged in a specific molecular configuration. So here is the diagram of the special four ring of steroids, and there is a they are arranged in a specific molecular configuration like here is the like numbering of the systemic of steroids of their benzene structure like J main principle. There is a two main principle. It acts as an important component for the cell membrane where it alters the fluidity of the membrane. It means um, so the steroids are the main component of the cell membrane. It alter the membrane into the body, like it decrease the inflammation and swelling into the body and relieve the pain. They are also called corticosteroids, which can act as an inflammatory medication. It is also used in inflammatory reduce sign symptom into the body. The core structure of steroid consists of 17 carbon atoms that are bonded in four fused rings, of which there are six-member cyclohexane ring and one is five-membered cyclopentane ring. It means these three are six-member cyclohexanes and one are five-membered cyclopentane ring. So before moving the action of mechanism, let's study of the steroids hormones. So these hormones are involved in the function of the control of metabolism, development of sex characters, inflammation, functions related to immune system like salt water balance. So what is that? So steroids are the basic component of our body for the influence of the sex hormone like testosterone or estrogen and reduce the inflammation condition into the body and like balance of the salt water into the cell tissues. Next is to be types of steroids. So there are two major types, which is glucocorticoids and the mineralocorticoids. So classification are based on the function and structure. So first is glucocorticoids. It relate metabolism, regulate and immune function of stress response. So glucocorticoids we are taking on that time we have on too much stress and any kind of immune deficiency and enhance our metabolism. So these medication are used for their powerful anti-inflammatory and immunosuppressive properties. Medications are prednisone, the dexamethasone, or treatment for autoimmune disease like rheumatoid arthritis, erytheromatous inflammatory bowel disease. So, if patient is suffering from autoimmune disease like rheumatoid arthritis or arthritis in small joints, and also the inflammatory are ball in our like ball and bladder into the inflammation have to be cause, and if there is like a skin disease like psoriasis and eczema like redness or like too much over formation of the cell into the bony prominence into the body over the in ICU patient they are like continuously laying on the bed. So psoriasis are occur on that kind of patient, and the cancer treatment reduce the inflammation around tumors in blood cancers, organ transplant, preservative immune receptors. Basically it works to reduce the inflammatory signs and symptoms during any kind of like abnormality are present in our body. Like first is like rheumatoid arthritis, so also there is inflammation over there during the like cancer cells, so reduce the inflammation in nearby the cancer cells to prevent the further any secondary symptoms cause. So Glucocorticoids are reduce them all the inflammatory signs into the body, or like preventing of immune receptors, or like organ during the organ transplant. So like if patient have like transplant their organ to different person, so the acceptance of different person body is not much 100% like accurable. So on that time glucocorticoids medication help to like help to preventing the immune rejection of the organ into the body. So there is a helpful for them. Next is to be mineralocorticoids. It regulates electrolyte and water balance primarily by increasing sodium reabsorption and potassium excretion. It means there is too much water loss into the body and abnormality in water salt water balance into the body. So on that time it will be increased to the sodium into the body and excrete out over potassium into the body. So that is the main function of mineralocorticoids. So by the help of kidneys. So example is of the mineralocorticoids are fluorocortisone, common synthetic medication produced in adrenal cortex in response of angiotensin 2. It means the fluorocorticoids, it directly act to the adrenal gland and it directly bind to the angiotensin 2 to reuptake the sodium material into the kidney and excrete out the excessive potassium into the body. Decrease the level can cause hypothermia and hypotension, while increase the level of hyperaldosterone and lead to hypertension and hypokalemia. It means if you are taking too much fluorocortisone, so it will be cause decrease the hypothermia and hypotension. It means high blood pressure you have to be on because too much sodium you in your blood. So if there is too much sodium into their blood, so long term exposure of to fluorocortisone caused a hypotension and increase the level of hypoaldosteronism and can lead to hypertension and hypokalemia into the body. There is a less of demand of potassium into the body. So if you are long exposure of the fluorocortisone medicine. Next is to be sex steroids. So, including the androgen, estrogen, and progesterone that regulate reproductive sexual characteristics and also have to like promote the secondary sexual characteristic like beard and mustache into the male and female have to be hormonal and periods and like breast like bigger breast you have to be shown the secondary sexual characteristics of female and male and gamete maturation spermatogenesis and oogenesis you have to be shown on the male and female. Puberty and sexual behavior also came in the female for on the time of sex steroid is to be activated. Bone metabolism and preventing the osteoporosis. It helps to metabolize an energy production into the blood and like helpful to like blood production into the bone, basically the long bone, and preventing the osteoporosis and decrease the pores into the bone and enhance the bone's strongest and rigidity over there. Neurological role like neuroprotective properties, aiding in conjunctive function and learning, memory, and neurogenesis in brain. It means it helps to neurons to remembering the neuroplasticity of the different kind of action in our body movement and function and learning different thing and store the different function into the hormone and different parts of the body. And neurogenesis is mean any kind of denervation and innervation into the nerve cells, so it will be promote and heal over there. And also the decrease the inflammatory signs into the brain. So that is the steroids. Thank you.